Good afternoon, everyone. My name is Warangkana Naksen. Today, I would like to present in the topic of empowering community health volunteers by implementing prevention of health impact from smoke haze pollution in rural district of Chiang Mai province, Thailand. I have to introduce myself first that my background is biochemistry and environmental science. But today I have to talk on the topic a little bit in the public health. So don't mind if I talk about the introduction longer than my research. Okay, today I will intro you first about where is Chiang Mai, Thailand, and how bad is the air pollution in this area. And then I will talk about my objective and the methodology of my research. And after that, I will talk about the results and discussion. Okay, first, I would like to introduce you to Chiang Mai, Thailand. Chiang Mai is the biggest city in Thailand. It's far about 700 kilometers from Bangkok. Here, it's very famous on their beautiful scenery and the old culture. It's the best destination for tourists in Thailand. Okay, but if you travel to Chiang Mai, Thailand in dry season, especially in January to April, you will find like this in this picture. There's a lot of smoke in the air, and it makes the viscosity in the area is really bad. In this picture, you will see the red spot. This spot represent the hot spots. It occurs from burning. In dry season, people will burn the agricultural residue and produce a lot of smoke in this area. You can hear about smoke, right? But in this presentation, I will call it smoke haze. Smoke haze will be a serious air pollution in northern Thailand annually in dry season. Major cause is from biomass burning. And you will see that the number of hotspots extremely increase in dry season, and we will call this time like a smoke haze episode. In this picture, you will see the brown area. The brown area represents the smoke density in the area. It's cover the Southeast Asia, including the northern part of Thailand. And the red spot that I have mentioned is from the hot spot from burning. Many hotspots occur in this area, and also in the northern part of Thailand. And some smoke can transfer from our neighbor countries to Thailand. You will see this side is Thailand, and this side is our neighbor country. You will see that the source of smoke is in the neighbor countries, but smoke can transfer from the neighbor countries into Thailand. But however, the source of burning also occurs in other countries too. The cause of burning is from two reasons. The first one is the agricultural burning. In northern Thailand, there's grow a lot of corn and rice in the area. And in dry season, after harvesting, they will burn the residues and produce a lot of smoke. And also the forest fire occur heavily in the dry season too. This picture shows you about the burning of the corn residues after harvesting. You will see that in dry season, the cornfield is really dry and ready to burn for burning. The factor that influence the smoke haze in this area is the topography of this area. In northern part of Thailand, there is a lot of mountains, and people will live in the valley. So in dry season, the temperature will trap the smoke produced in the valley, and the smoke can left from the valley and it trapped in these basins. This picture shows you the monthly hotspot occur in the area. You will see that the hotspot will start occur in January, February, and the highest is occur in March and April. After that, in the wet season, the hotspot is reduced, obviously. The orange spots represent the hotspot occur from burning. Okay. If we see on the details which area in Chiang Mai district that has a lot of burning, you will see in this graph the district that has a lot of burning in Chiang Mai is called Om Koi and Mae Chang district, which locate in the south part of Chiang Mai, Thailand. In this picture, show the number of hotspots occur in monthly, and also the average PM10 occur in each month. You will see that the number of hotspots will be increased in the January, February, March, and April in every year, and it is correlated to the level of PM10 or particulate metals. You will see that the particulate matter concentration will also increase in this period of time too. And if you see this line, the orange one, it is standard of healthy level. The above one is the Thailand standard, and the below one is the WHO standard. This picture shows you the view of this is the Doi Suthep mountain. Is very famous mountain in Chiang Mai. I took this picture from my office at Chiang Mai University. You will see in the January, the sky is still clear. You can see the view of Doi Suthep very clear. But in March, when the PM particulate matter begin to increase, you will see that the Doi Suthep mountain disappear like there is never been there before. Okay, what is in the smoke haze? The pollutants in the smoke haze occurs from biomass burning. So the pollutants, the important pollutants in the smoke haze in northern Thailand, including smoke and small particles, such as PM10, PM2.5, and PM1, and polycyclic aromatic hydrocarbons, or PAH, and volatile organic compounds, or VOCs. I will introduce you some important pollutants in smoke haze. The first one is particulate metals. Particulate metals is the small molecules produced from the biomass burning. It differentiates by their size. The important particulate matters is PM10, PM2.5, and smaller size of PM particulate matters is very more dangerous because they can enter to our respiratory system, lung, alveoli, and small one, the PM particulate matter smaller than 1 micrometer in diameter can enter to blood circulation. The other one is polycyclic aromatic hydrocarbons, or PAH. US EPA set 16 compounds of PAH that have to be aware carefully because most of them are carcinogen and can found in the smoke. Before I talk about my research, I would like to introduce you about my research. The research about air pollution and health in northern Thailand. The first one is the research that about the monitoring of biomarkers in the Urinaly school children in 5 provinces in northern Thailand. The results show that the people living in this area in 5 provinces are exposed to the air pollutants from smoke haze. And it's very interesting that people living in the rural area, the violet bar, are exposed to air pollution higher than people living in the urban area. And another research also found the same result from the previous research. They found that the school children living in Mecham, if you can remember, I mentioned that this district has a lot of hotspot burning, highest burning in Thailand. They also exposed to air pollutants higher than children living in other area, other countries, like in China, in USA, and as well as in Bangkok, Thailand. So, who is at the high risk of impact on health from air pollution? Yeah, the people who had a higher risk is people who have a disease, especially asthma, heart disease, and a long-term lung disease such as COPD. There is some research in northern Thailand. They found that they found the positive correlation between peak expiratory flow rates with some air pollutants in smoke haze in Thailand. And another research, they also found a positive correlation between the emergency visit of exacerbate of COPD and asthma and PM10 and another air pollutants in northern Thailand. And they also found that the relative risk of emergency visits in people with PM10 higher than WHO standards levels. And in 2015, in our research group start the project in Machang district. We interested in the COPD patients. So we recruit the subjects from Machang Hospital, and we collect data from questionnaire and also the sample, biological samples such as urine to measuring the biomarkers of exposure to air pollutants. The extent activities from the previous study, we also collect the personal PM2.5 sample. We collect the 24 hours, 7 days PM2.5 sample from the COPD patients and controls by asking them to carry the device all the time. From this study, we found that COPD case has exposed to PM2.5 higher than the control, both in the smoke and non-smoke season. So what we found in the previous study makes me interested how to reduce health risk from air pollution in this population. Okay. In 2016, the National Research Council of Thailand, or NRCT, called for proposal for research for community program, and Chiang Mai University called our group to submit the proposal because they want to do the intervention in the people who exposed to smoke haze air pollution in northern Thailand. This is our group. This group is led by Dr. Tipawan Prapamunthun here at the center. So the goal of this project is to develop awareness in community on air pollution and its health effect. So the objective of the project is to develop training materials and program and to implement training intervention program to community health volunteers. And the last one is to evaluate training intervention program. The target group of this research is a health volunteer from 7 sub-districts in Mae Cham district. The methodology. First, we plan to do the research by scoping the information from the literature review and the previous study, and discussing with the party network in community for planning to do the research. And then we prepare to do the research by design the intervention materials consisting of booklet, games, and educational kits, and design the interventional program. Then we perform the intervention activity designed as a half-day camp, and after that we evaluate the successful of the project. The first one, we do a group meeting with the party network in the community, including health volunteers, health personnel from hospital, and the representative from public health office of the district. And we design the materials and program for training. The training materials including of booklet, demonstration models, and educational game kits. And we design the training program as a half-day event containing 3 stations. And the training methods including lecture, game activity, and demonstration. This is the booklet that we create in this project. The target of the booklet is the health personnel, health volunteers, and teachers in the community. The topics in the booklet consist of air pollutants in smoke haze, impacts of smoke haze, healthcare practice, and alternative choice for managing crop residue and burning, which is the cause of air pollution in the northern Thailand. And the content in this booklet will consist of basic information, scientific research information, and take-home message. And this is the demonstration models and educational game kits that we use in the program. The demonstration, we demonstrate the participants by showing the air sample and the PM10 2.5 concentration on the filter membrane, and also show the size of PM10, the real size under microscope. The training case, we decided to use the flip chart, and we create a DIY smoke haze model kit, and we also use a game. We use a bingo quiz game. Okay. The training program, as say, is a half-day event containing 3 stations. The first station is about facts, situations, and solutions about smoke haze pollution in northern Thailand. The second station is about particulate matters and air pollutants. The last one is about health effect and appropriate practice during smoke haze episode. And in the training, we use lecture, game activity, and demonstration. After that, we evaluate the activity by use pre and post tests and satisfactory assessment, and do a focus group with the party network. And we also do a social return of investment. Okay, this is the questions we use in the pre and post test. That consists of 15 questions. It's the basic knowledge about air pollution and health effects. And the results show that the score in the post test was significantly higher than pre-test scores. And we found that the participants very satisfied about this activity. And in the focusing group with stakeholders consisting of representatives of health volunteers, health personnel from hospitals, representatives from public health office of the district, and villagers. The result from the focusing group showed that the participants well know more about smoke haze and its problem. The health volunteer contribute to the health who participate our activity. They deliver the message to other 3 residents in the community, which assume to have better knowledge and practice of reduction of exposure to smoke haze. And we found that the number of hospital visits from smoke haze decreased after the activity, but cannot imply that it's result from our activity. The repeat interventions were recommended by the participants in order to produce better retention of knowledge. Like I said, that I also calculate for social return of investment of this project. And we found that the most beneficiaries of this project are the people in the area, followed by the respiratory disease patients, and each baht invested in this project generates the social return of 1.73 baht. And the conclusion of this study, the intervention was successful in increasing knowledge of air pollution among health volunteers in Naksen district, Chiang, Thailand, and extending transfer of knowledge to people in the community. Number of hospital visits and admission of patients with respiratory disease such as COPD and costs are reducing, but cannot be claimed that it was result from this project. However, subsequent intervention and improvement of evaluation approach were recommended to achieve to sustainable and scale up intervention in the larger population. Community health volunteer is a key person for preventing health impact from smoke haze pollution, especially in rural districts. Okay, I have to thank you this conference to sponsor me to be here, and also the National Research Council of Thailand to fund this project, and also the Theparat Veshanukul Hospital in Naksen district to support our project, and also Research Administration Center, Chiang Mai University, and I have to thank all participants and collaborators in this project. As I say that I'm very new in this implementation research, so all recommendations are welcome. Thank you.